Hi, everyone. Thank you for joining us on today's webinar, How to Keep Your Team Civil and Compliant as we navigate HR in this post-election era. So excited to have all of you on today. We're getting a lot of questions from our clients on how do I navigate kind of with my team the situation at hand, whether you like the results of the election or not. That's not really what matters for today. We just want to help you to know how to kind of work through this with your team as these situations arise. And little bit of background on me. My name is Jill Hasselman. I'm the Chief Growth Officer at HR for Health. I've been with the company for going on 11 years now, and gone through multiple elections while I've been at the company. And we want to just, again, help you to kind of sift through and navigate what's the right way to handle some of the emotional situations that can come up. Of course, the laws that change as these things come up. And while we don't have as much of a grasp on how the laws are going to change as we go into next year and thereafter, we do kind of have some good ideas of how this has worked in the past that we'll share with you. So very excited to jump into today's content. I do want to just kind of shout out, if you have questions, please feel free to send those as we go through today's content, and we will get back to you if we're not able to get to those during the webinar today. We'll probably take about 30 minutes to talk through these pieces. And like I said, as we wrap up, going into later today, going into tomorrow, we'll get those questions answered and make sure our team helps you. So this slide, I think, is really important. While the election is over, the impact on workplace conversations has just begun. This might be something that you've already been dealing with leading up to the election, and kind of understanding what's okay to talk about, what's not okay to talk about, how is this going to impact my business? And so these are all things that we're going to talk through this afternoon. So first and foremost, I think it's important to kind of set the stage where when we look at surveys and data that has been gathered about how do employers and employees feel about political discussions and the election and bringing that into the workplace, about half believe that political discussions hurt the work environment. And so I think at the same time, it's unrealistic to just expect our team to leave any concerns at the door when they sign on for work each day. And so just banning political discussions from the workplace could risk making employees feel silenced or disengaged, or even distrustful. So forbidding them from talking about politics can have broader implications, just beyond morale. So there are things where we can prohibit as employers, we can prohibit employees from having certain discussions. It is illegal to ban them from talking about anything that could be related to their work conditions, which is very relevant to HR in a lot of ways, because political shifts can lead to significant changes in employment laws. And this can be felt at all different levels, so federal, state, city, and policies and regulations widely range depending on where you're located and what those changes look like. And a change in administration at the federal level typically does bring in new priorities for those federal agencies. So like the Department of Labor or the National Labor Relations Board, the NLRB. And so, like, for example, what we saw when the Trump administration transitioned to the Biden administration in 2020, that led to a lot of changes in wage and hour laws and worker classification standards. So you remember about a year ago, there was a lot of talk around independent contractors and who classifies as an independent contractor versus an employee. A lot of that had to do with the transition from the two administrations. And so that's likely what, we'll see again. And when we look at the federal laws, there's also the states, because states are not just, passive in this. They, of course, have to take into consideration the federal policy changes. But then you have states like California or New York, and they might have more stringent labor laws or more complex regulatory environments for the businesses that are operating within their states. And so it's important kind of going into this to understand, and we'll keep, of course, putting out information as things change. But we are kind of in this middle ground right now where we do have to see what might come that's new, but also what we do see when there's a shift in who is in the administration is that there might be a reversal of previous mandates or regulations that are in the form of executive orders. And so again, using the independent contractor example, when the Trump administration was in effect, there was a broader definition for what an independent contractor could be, and those were rolled back by the Biden administration, which resulted in stricter worker classifications. And so these reversals could happen going into next year and the years after. But the biggest thing is just understanding that you want to be able to quickly adapt your HR and making sure that you're staying compliant as these things come to light. So how is this affecting our practices? Each practice that we're working with, and I know your practices are small to medium-sized practices. We have close-knit teams that work very hand in hand with each other day to day. And so sometimes this can create tension if there are politically charged conversations. So kind of shifting into how do we navigate this with our team? How is this impacting our practice? And there's also an aspect of patient care and how we communicate with our patients and what conversations are okay to have with our patients and how do we manage this. And all of it is really, really important because political discussions can foster or hinder inclusivity. So this depends on how it's handled, and this can potentially lead to more tension or less tension depending on if employees have differing viewpoints. And keep in mind that employees may feel disengaged or less motivated if they believe that their practice or their workplace is not aligned with their values, or fails to address significant political or social issues. And so taking the stance of we're not going to talk about it at all, it isn't necessarily the best route, but also being careful about what is talked about. Because the other part is that most, when we look at these surveys, and again, the data that we're kind of compiling is that more than half, so about 59% of survey respondents believe that their boss's political beliefs influence their management style and or their decisions. So if the employees perceive that there's something that you feel really, really strongly about outside of the workplace and that that's something that can influence their day-to-day, that can impact how they're interacting within your practice and within your business. Because then a quarter of people have said in these surveys that they either left a job or wanted to leave their job because of their boss's political beliefs. So when we look at how this can impact your practice, it definitely can create distractions. So that's something, political conversations, especially if they're contentious, absolutely divert focus from the patients, from the work that they're there to do, and that can decrease productivity. It also can create conflict management pieces that now come into play. Conflict management is something we always have to deal with, no matter what each day, because we don't know what's going to come our way, and we're all humans and we're trying to interact with each other. But this can definitely increase the time and resources that might be required to address interpersonal conflicts that could stem from political discussion. And really, again, thinking about what job seekers or what your current employees might be aligning with in terms of your values. So they're often looking for practices that are aligning with their political or social values. And so a lack of alignment can deter potential hires if that is a sense of importance in your practice. And so it also can relate to retention, because if it's not just job seekers, it's also employees that might feel like they need to leave the practice because, again, there are different values. So it does come into the day-to-day regardless if we want to or not. So some ways, you can see on the slide here, as clients, some features to definitely explore our notes section. So when these conversations happen or as you're navigating through this, the notes section in our software is super helpful for this. That's where it's a private place in the employee's file where you can go and make just that, a note. You can make a note about this situation that happened just so that you can kind of keep your eye on that and make sure you have that documentation. The employee handbook is super, super important. We'll get to that in a little bit of some tips and tricks on how your policies can help you here, because we want to try to create an objective environment as much as possible that, again, really represents your values and how you want your business to be running. And then, of course, violations. If in your policies that you have established through your employee handbook and HR for Health, if those are violated, you definitely want to document that in the violations section. And so just a reminder, if you have not used that section before in our software, there are 3 types of violations that we have. And again, this can be used for any situation. It's definitely relevant to the conversation today around, the political opinions and conversations that might be happening. But the 3 types of violations we have are private. So that means that an employee doesn't even see that in their employment file, but it gives you a template on how to document each instance, exactly what happened, if there was anybody else involved, how it was resolved. And then we have informal violations, which an employee can see in their file, but it's not going to ask them to do anything with that violation. And then we have a formal violation, which will actually ask the employee to sign off on that violation. So those are 3 really good tools kind of at your disposal that you can use that we'll reference back to as we're talking about, how to address this and what to have in place. But just don't forget about those features. If you have questions on how to use them, please, please, please reach out to our team. They can help walk you through how to do that. So how do we establish ground rules? What are the ground rules? What should they be? So really at the top, it's absolutely vital to communicate clear expectations on what appropriate work conversations are to prevent any misunderstandings and conflicts. And again, this is really for any subject, but on this particular one, it's really important to be very consistent and fair in terms of what your expectations are and how the employees are following it. Because as private employers, we are not legally required to allow political discussions in the workplace. So I think there's some misconceptions on this sometimes around freedom of speech and what is allowed to be talked about. Public employers or government-run employers are absolutely have different laws. As private employers, you don't have to require allowing political discussions. And so you can set policies or that limit or prohibit these conversations to maintain productivity. Now, remember what I said earlier, it's not always the best idea to just say, you can't talk about it at all. That can sometimes backfire and not land the way that you're intending it to, but there absolutely should be a framework around how to address and navigate this conflict, which we'll get into in a second. Also keeping in mind there is an aspect of protected speech. And so some political discussions may intersect with legally protected activities. So this is going to be around union organization or addressing workplace conditions. And these are things that are protected under the National Labor Relations Act. So this is where, again, it intersects because there might be some political discussions around laws that are coming out that impact the workplace that we cannot say you are not allowed to talk about those things or ask questions. So there is that fine line that you definitely want to balance. And you also want to make sure that you have your policies around hostile work environments, because that's kind of where this sometimes falls back into, is that if political conversations create a hostile work environment or involve harassment, then you do need to intervene to make sure you're in compliance with anti-discrimination laws. So make sure that you keep that in mind. Again, we'll talk a little bit about some tips and tricks for your policies and what we have in HR for Health already as a client, what this looks like. But just making sure that you're aware that if tensions are rising, that you don't want it to end up into some sort of claim around hostile work environment. And then definitely kind of thinking through the pros and cons of maintaining political neutrality versus taking a stand on key issues. So again, expecting employees to just leave their feelings at the door can sometimes be difficult. They can feel more suppressed and it's not as helpful. And so having policies around just this neutralness around some of these issues definitely can be helpful. And so providing them with guidelines around what that looks like and those clear policies, and also training on how to engage in respectful conversations in the practice is really important. Another few things to note here is we get a lot of questions around, well, this person is talking about things while they're off the clock. So kind of this off-duty freedom of speech. And again, whether it's any topic or this topic, you can discipline employees for off-duty political speech on like social media, for example. And you can establish that violates company policies, it disrupts the workplace, it damages the company's reputation if they're representing the company or the business while they're having those conversations, or if they're posting on social media. We'll get into that. The social media piece I know is tricky, so we'll get into that a little bit in a second as well. And keep in mind, again, depending on the state that you're in, so California and New York, I think, are always great examples of states that do have laws that protect employees from being punished for lawful off-duty political activities. So if you're in those states and you have questions about that, please reach out to us. We can help you to navigate that, because that's where the federal versus state laws do come into play. But employees should be aware and should know that when they are appearing to speak on behalf of the practice, and if they're discussing things online, like on social media, and they are perceived as representing your brand, you absolutely want to have conversations with them on what the appropriate way is to handle social media, especially if they're posting, on behalf of you, and that there's that neutral language and verbiage that's used. And then just keep in mind where there are protected activities. So if employees are using social media to discuss their specific workplace conditions or labor rights that might be protected under some different laws, depending on where they are. Again, most of it goes back to the NLRA laws, that you are not disciplining them if they are allowed to do that. And then it kind of on that same vein, that there are anti-retaliation protections for practices or for employees. And so these laws protect employees from being retaliated against for engaging in lawful political activity. So again, this depends on your state. And I think the best tip here is, and we'll go into the employee handbook and policies in a second, but the best tip here is make sure that your practice values are really strong, are communicated, and that those are encouraged to speak with the employees about, and they really understand how your practice is, what the values are of the practice and how to operate within those in terms of respect and diversity. So how do we navigate these tricky topics with clarity? So absolutely rely on our HR advisors and our HR resource center. We are constantly putting out new content, constantly in terms of the resource center. Our HR advising team is there to help navigate through these complex situations, to help you to document things if you do need to write up a violation or put something in the notes section. But ultimately, I think really advocating for an environment of respect and having respectful boundaries will help to protect your team's cohesion. I think that a great tip or trick to do during, as we go into the end of the year and we have the holidays, is doing team buildings. If you have your holiday party, like encouraging employees to interact in ways that kind of take their minds off this. I think that's why like a structured team building can really be helpful, because it gives the employees things to bond over and really work together on that are outside of the practice and also outside of kind of the day-to-day world and that anxiety or stress that might be brought in from the election for some people, where they don't want to have those conversations. That allows them to bond within a structure outside of that. Because establishing those boundaries really helps to make sure that people's personal beliefs are not disrupting professional interactions. So the best way that you can really put this into action outside of, again, getting the team together for a team building is reinforcing these policies regularly, and trying to keep these conversations as objective as possible. Getting into the how. So again, always using our HR advisors, using the resource center, but really encouraging open, non-judgmental communication and using structured conflict resolution methods is really important, because in any team, there's a risk that personal discussions can escalate. And again, we're in such a small environment with small teams that it's really important that we can de-escalate this effectively. So when we're looking at our policies that we want to be able to fall back on, some examples that you can bring into play or just what to keep in mind is, first and foremost, when in your policies that are addressing this, explaining that the policies are aiming to promote a respectful and inclusive workplace. And again, ensuring that these political conversations do not disrupt operations, create conflict, or of course lead to harassment or retaliation where it's not allowed. So making sure you're also explaining these policies apply to all employees, contractors, representatives, anyone that is within the practice or interacting with the practice during those work hours, on practice premises, at any work related events, or whenever representing the company on social media. So establishing this is the purpose of the policy, but this is also who it applies to is really important, so everyone knows that they are a part of that policy. Also explaining what is allowed in terms of discussion. So some ideas here are allowing political discussions only if they're relevant to work. So like labor laws, healthcare benefits, that sort of thing. And then conducting respectfully that does not disrupt the operations of the practice. So if there are conversations that are creating conflict, that does disrupt the practice operations and is something that absolutely should be addressed. Also clearly stating what is not allowed. So things like campaigning or distributing political materials during work hours. Of course, harassment or creating a hostile work environment based on political beliefs. And then again, what's not allowed is disruptive debates or conflict over political topics. That's absolutely okay to have in there. Again, depending on the state that you're in, HR for Health will automatically fill in these policies depending on what's allowed. So if there are certain pieces of political topics that do need to be allowed, based on the state, that will be included in there. And then also reviewing the social media guidelines and what that looks like. So making sure that you're communicating in your policies and reinforcing that employees can discuss political topics, but they must clarify that their views do not represent the practice. They shouldn't be using any, practice logos or email addresses or anything else that identifies them with the practice unless it's authorized, and that they need to comply with your confidentiality policies and any anti-harassment policies. So making sure, that you're explaining essentially employees should not imply that the practice endorses their personal political views, really important. Establishing what prohibited behavior is on social media. So again, posts that defame the practice, its leaders, the doctors, your coworkers, and then threats or harassment directed at others online are absolutely prohibited. And then also adding in there that the policy does not restrict employees from engaging in legally protected activities. So things like discussing wages, working conditions, anything that's protected by state law that they're allowed to do. And again, as a client, these things will be automatically filled into your employee handbook for you because we do that for you. but making sure you're reviewing it and knowing what's in there and talking with your team and reviewing those policies. And when you're doing that, absolutely highlight the complaint process. So explaining that employees are encouraged to report any concerns about political speech or conduct to the doctor, to your office manager, whoever is that appropriate contact person, and that they can do so without fear of retaliation. And then provide that structured process for addressing complaints. So that might be mediation, disciplinary action if necessary, but really making sure that that's clear. And then make sure that you're providing training to, if you do have managers that are responsible for overseeing this, providing training on respectful workplace communication and what that distinction is between personal and professional boundaries. And really that comes back to, is this productive for the business? Is this helping the practice move forward, or is this creating distractions and issues? And then always having that wording in there that the policy will be reviewed annually or periodically and will be updated as necessary to comply with any laws and the workplace needs. You should always have this in your handbook, but again, making sure that you're actually going in and reviewing these policies and making sure that they make sense for your practice is really, really important. So creating psychological safety absolutely is key. Trust is key in the practice. Our teams work directly with each other very closely and also with patients. And so making sure that they understand that there's a supportive culture that is encouraging team members to voice their opinions respectfully is important, and helping to kind of guide them on what that is. So it goes back to your values as a practice, which ideally is emphasizing inclusivity, respect, open dialogue, and setting clear guidelines for communication and behavioral standards. So emphasize that there is a respect for differing perspectives and that there shouldn't be too much that is being brought in that is distracting from why we're all there, which is to deliver great care to our patients. That's the first thing that's the most important. All roads should lead back to that. And absolutely fostering like open and respectful dialogue. I think the biggest thing as leaders is this starts with us. We need to model that behavior and demonstrate how to discuss sensitive topics respectively, staying neutral and balanced when moderating these discussions if you're involved, and just trying to keep it as objective as possible. And really encouraging not just yourself, but your employees to have active listening and to understand or not invalidate or argue with other people's experiences is really important. That is going to help to create a safe space. And if you really need to have facilitated discussions or group discussions, if things have really escalated, do that in a safe space, again, that allows employees to kind of share those perspectives without judgment. Another kind of cool thing that you could do, and this is for really anything, but timely for right now, is offer training on emotional intelligence to your team or respectful communication or managing bias. And this can help the employees to recognize unconscious biases that might be influencing their reaction to other people's opinions. And this helps to kind of build this foundation for conflict resolution skills, which is teaching them strategies to resolve these disagreements constructively. I think also super important is promoting neutrality in the workplace. And so really, if you're able to have them focus on the mission and vision for the practice, this can help to redirect conversation to the shared goals and objectives when disagreements might escalate. And again, setting guidelines for anything related to political paraphernalia, if you will. So like buttons, posters, hats, shirts, that should be in your dress code policy to avoid any unintentional exclusion or, division between the employees, because you want to make sure that your policies are inclusive. They allow and protect the employees from discrimination or retaliation based on any views that they might have. And really reviewing your policies and walking the walk when it comes to this Very, very important. The last thing I'll kind of leave you with on this piece is absolutely monitor and address any toxic behavior. So there should be zero tolerance for harassment. If there's anything that's witnessed or reported to you, immediately addressing that, especially anything that might threaten psychological safety or, mocking or excluding others based on their opinions is super, super important. And having that proactive aspect of training the team or training the managers to recognize those signs of discomfort or exclusion and intervene and make sure that you're addressing that is really, really important. Don't just let it go. It can fester and create a bigger issue, which can lead to retention issues or hiring issues, which I know none of us want to add more issues onto that. And lastly, you can absolutely engage with the employees through surveys. I would say regularly assessing whether employees feel safe expressing themselves or if they feel like they have that psychological safety in the practice. Anonymous surveys are a great way to do this. SurveyMonkey is a free resource that you can use to be able to gather that feedback. And then once you get that feedback, act on that feedback and continuously improve on your policies and put that into practical action, because that's the best way that you can do this. Couple notes on this: performance reviews. This is definitely, if you're not doing performance reviews, now is the time to start doing them. I recommend doing them on every employee's anniversary to be able to gain insight on how they view the practice and view the team and view you as a leader, and then vice versa. You can give them that feedback so that you can address these things early on and have that feedback loop that just feels normal moving forward. This is a huge one. Look, if you do nothing else, I think subscribe to our blog. Make sure you're paying attention to our emails that we're sending out monthly, weekly, as these things change. Like I said at the beginning, we don't know exactly what's going to change right now. We just know that the only thing that is constant is change when administrations tend to have these transitions. And so because these labor laws could start to shift, things like minimum wage, workers classification, independent contractors, sick leave, all of those aspects that you're going to need to stay up on, because as these things change, we need to keep our policies up to date and prepare to be able to incorporate those changes into the practice. So as clients, we are constantly letting you know when these things change. We're updating your policies for you. We're updating your new hire documents for you so that you can stay compliant, but just making sure you're paying attention as our team's working super hard to notify you about these things. So and I know I said it was going to be 30 minutes. I'm going a little bit over. So definitely putting your questions in. Again, I think one of the most common ones that we get is, how do I handle these political discussions, which I think that we went through, and what if it makes people uncomfortable? And I think the best advice that I can give is trying to instill within your team. My team hears me say this all the time, which is the information that is being communicated helpful for somebody to be able to do their job better? And if the answer is no, and political discussions can absolutely go into that, then it probably is best to not have those discussions and really explain why that can be distracting to the overall goals and mission and value of the practice. Another question we get a lot that's pretty common is, how do I introduce new policies after an election or after things are heated? And this is something, there's no better time than now. We're going into the end of the year. I know so many of you are already talking with our HR team about updating your policies and getting everything in place for 2025. This is the best time to do it. You can kind of use that as the excuse of, it's the end of the year, we're going into a new year, we're rolling out these new policies and making sure they understand they can see the policies in HR for Health at any time. There's full visibility and transparency to the handbook and the expectations for each employee in there. So using the software to your benefit, I think, is the best way to start to introduce any new policies that you do need to make an adjustment for. And it doesn't have to just be about the election. You can make it more about, it's year end and we're just getting things getting things up to date as we go into the new year. So kind of key pieces to review and really self-reflective is my practice doing this right now? Am I really walking the walk? Is first and foremost, are you promoting respect? Are you encouraging a culture of listening and respect to keep political conversations, if absolutely necessary, constructive, and really helping the practice to succeed, but having that respectful environment? Is that something that I am promoting right now? And if not, that's your first step, is starting to promote that active listening and that mutual respect. Absolutely. Am I setting boundaries? Am I using my policies? Do I have very clear, compliant things in writing that are helping to guide behavior and reduce misunderstandings? If you've heard me on webinars before, you've heard me say a million times, it's not enough to just have your handbook, you guys. An employee handbook is your foundation, but you have to actually use those policies. When situations arise, referencing back to what does my policy say about how this should be handled, and following what it says. And if it's not working for your practice, then that's a really good sign that it's time to update and amend some of those policies. Do I have a way to quickly address potential conflicts to prevent escalation? And am I using HR for Health's team to help me to deal with conflict management and all of the resources that we have? And am I remaining proactive about staying compliant? Am I paying attention to all the webinars and newsletters and blogs and everything that HR for Health is putting out there? Am I using the software to help make sure I'm staying compliant as these things change? Those are really, really good things to check off going into the end of the year, because like I said, the only thing that's going to be constant is the change. So we need to make sure we can adapt to that. And I think really overall, acknowledging that regardless of individuals' political parties or beliefs, if tensions are running high, that many team members might be feeling stress or fear related to what's happening. And so reminding your employees that the workplace, the practice, is a place where everyone should feel safe, welcome, respected, and included. That's your oasis. And so making sure you're communicating to the team that you don't want to limit healthy dialogue about social issues, but you do have a vested interest in reducing disruptions and maintaining that culture of respect. So encouraging your team to approach these conversations from a place of curiosity and accept that they might not find common ground. These conversations can be used as an opportunity for better understanding, and maybe not using it to try to change somebody's mind, but ultimately the goal for everybody is to feel like they're heard, and that what they're being heard on or what they're expressing is something that is helping to contribute to the practice being more successful. Again, that's with any topic, but I think that's a great North Star to keep in mind, because with these strategies and having the right tools and using the software to the best of its ability of what it's there to do for you and help to keep all these things in place, all the documentation and all the expectations, definitely can help to maintain a positive environment that's also a compliant environment. So if you are not an HR for Health client, or if you have questions on how to best use the software, as a reminder, our goal is to prevent you from having to deal with these pitfalls and having to prevent you from feeling like you're approaching them by yourself. Our HR team is essentially their therapists without the license. They are focusing on how to help you navigate from a way of not just what's best for the employees, but also what's best to help protect you. And so having that consistency is really important. So again, if you have questions on how to use our time clock the best to make sure that you're reducing wage and hour claims, or is my employee handbook really working for me in the best way that it can, please reach out to us so that we can help you with this. And so this is a QR code where you can scan to book some time with our team if you have any questions. Here's our website, our email address. As I kind of leave all of you, just know, as as these things change, we will be doing more webinars so that you know from a compliance perspective what you need to be falling in line with in terms of the laws. We do have our law update webinar coming up in the coming days, which is our traditional law update webinars that we always do at least twice a year. So just keep this top of mind. It's not going away anytime soon, but we're absolutely your advocate in helping you to navigate it. So I appreciate everybody joining us today. As I mentioned, we will get to your questions on a one-to-one basis and get back to you with answers there. But I look forward to doing one of these again soon and hope everything is as calm as possible moving forward. But like I said, we're here to help if it's not. So thank you for joining us.